This is the recording for Occupational English Test, and the test is held at MedCity International Academy, Kannur on 19th March 2025. The candidate's name is Suvarna Raj. The candidate number is 6342. The interlocutor is Roshni and the interlocutor number is 6659. This is role play number 1 for the profession of nursing. Good afternoon, Suvarna Raj.
Good afternoon, ma'am.
Can I see your identification,
Yes, sure,
please?
ma'am.
Okay, here you go.
Thank you.
Okay, this is a test of your English language and not an assessment of your professional knowledge. Keeping that in mind, speak as you would naturally. Now we'll start with a warm-up session. This is not in any way assessed, it's just to know each other's voices. So, Suvarna Raj, tell me, why did you choose to be a nurse?
Yeah, well, when I was a child, I used to help others. So that made me to go on choose the nursing as I was growing up. So I love the way the nurses or the doctors, how they're treating the patients, how well occupied the hospital was. So by looking all those things, I was very good to know that even I have the same qualities to help others. And after completing my place 2, I have choose the profession nursing so that I can help many of the patients who are ill and who are not able to go to the hospitals. So that's the reason I chose my profession.
Okay, great. And do you have a role model?
Yes, I do have a role model. My brother is my role model. When I was not feeling well, when I was there in 10th standard, he was the one who helped me a lot, as he was also a nurse. Comparing then the other nurses, he took care of me very good and very appropriate manner. So it helped me a lot by seeing him. I was more inspired. I was more inspired to take this profession as well.
Okay, great. Now that's the end of the warm-up session. Now let's move on to the role play. I'll be taking the part of the patient or the bystander, and you'll take the professional role. The role play will last a total of 5 minutes, and you'll be given 3 minutes to prepare on the same. So this role play just intends to get an evidence of your ability to perform effective communication with patients. Do you have any questions?
No, ma'am.
Okay. So here is your role play card. Here is your pencil. You can make notes on the card if you wish to do so, and you can keep the card with you during the role play, but you must return it to me at the end of the role play.
Sure.
Okay. So your 3 minutes of preparation time starts now. Okay, Suvarna Raj, that's the end of your preparation time, and your 5 minutes of role play starts now.
Yeah. Hi, good morning.
Good morning.
My name is Suvarna Raj. I am the nurse here at the clinic.
Okay.
So for my confirmation, may I know your name?
My name is Maria.
Thank you, Maria. Have a seat, please.
Thank you.
So you have come here for the vaccination, right?
Yeah, exactly. Yes.
Okay. Before we proceed with the vaccination, do you have any other concerns?
Actually, nurse, I don't have any concern regarding the vaccination. I'm not worried about that. But what bothers me is that my daughter just had a ear infection, and I'm concerned that she'll get the ear pain during the flight.
Okay. I do understand your concern, Miss Maria. So before we proceed with the vaccination, I would like to collect few details regarding your daughter Ria. Is that okay?
Yeah, definitely.
Okay. Could you please tell me the duration, treatment and previous occurrences?
Yes, actually, she had this ear infection which lasted for about 2 weeks.
Okay.
And it just got cleared up a few days ago.
Okay.
Then regarding the treatments, she was on antibiotics. Then no, regarding previous occurrences, no. Yeah, she had a couple of ear infections before.
Okay.
That's the reason why I'm worried about the pain on the flight.
Okay, so that makes some sense.
Okay.
So, like during flight journeys, so many will like ear pain is very common.
Okay.
So, as you said that your daughter is having the ear infection, so that is mainly because of the changes in the air pressure, which causes discomfort in the eustachian tube.
Okay. Okay.
Am I making sense?
Okay. I understand.
So, do you have any other questions to ask me?
I understand the reasoning that you gave me. So, what I think or what I feel now is that I'll keep her awake before the flight so that she's really tired, and if she'll just sleep the whole time during the flight, and then like she won't feel the pain, right?
Yeah, I see, but why you might think of that one?
Because like if just in case during the flight you said that there are possibilities for the ear pain to get worsened during flight.
Yeah.
So if she's sleeping, she will not experience the pain, right?
I do understand you have concern, but when you are making her asleep, she might feel when you are making her to sleep. So during takeoff and landing, so that does not give an equalized pressure in the eustachian tubes.
Okay.
So then she may get up while having the discomfort in her ear.
Okay.
So that doesn't make you have to make her to sleep.
Oh,
So
I understand.
you make her awake so that by giving her a water or having some breathing exercises or ask her to suck some sweets or do an yawning.
Okay.
Is that okay?
Okay, I understand. So just like I understand your point, and I'll make sure that she's awake during takeoff as well as landing, and I'll just try the steps that you have suggested. I think that should make things better.
Yeah. And additionally, I wanted to suggest you to give paracetamol for ear pain
Okay.
only if required.
Okay.
30 minutes before the flight.
Okay.
And I want you to give her some distracting things during the flight, making her to read some books.
Okay.
And watching some films.
Okay.
And additionally, she can have like playing games in the
Okay.
video games somewhat.
Okay.
And I want you to establish her to have some gently exercises so that she can avoid that pain.
Okay, fine.
Am I making sense?
Yes, I understand.
Okay. So, do you have any other concerns to ask me regarding all these ear infections regarding your child?
No, it is clear that like what you have said is clear that like to avoid that possibility, like I'll do the suggestions or I just follow the suggestions that you have given. I'll try to make her distracted in one way or another so that she is not focused on that. Her focus is not on the pain.
That's good to hear from you. So can we make arrangements for the vaccination for you and your child?
Yes, definitely.
Okay, thank you. So I'm going to arrange the things for. I'm going to arrange the requirements for the vaccination. So just give me a second.
Yeah, sure.
Thank you for your willingness to take the vaccinations for you and your child, Miss Maria.
Okay,
Thank
fine. Okay, fine. Thank you. Okay, so Raj, please return the role play card to me. That marks the end of your speaking. Thank you.
Thank you.
MedCity International Academy. Trusted hands forever.